everybody. Dr. Rafage. We are continuing through this issue of Veterinary Surgery from 2022. Outcomes of 25 female dogs treated for ectopic ureters by open surgery or cystoscopic-guided laser ablation. Study comes out of France. The objective is to report outcomes after the correction of ectopic ureters by open surgery or cystoscopic-guided laser ablation in female dogs. Retrospective study from 2011 to 2018, 25 female dogs. And for those who watch this channel a lot, you know that retrospective studies have the added downfalls of being inconsistent in terms of medical records, not having a lot of cases usually, so it's hard to compare stuff. Results found that 15 dogs had bilateral ectopic ureter and 24 were intramural. Open surgery correction included 13 neo-ureterostomies, 2 neo-cystoureterostomies, and a combination of these in 2 dogs. 8 underwent the cystoscopic-guided laser ablation. Minor complications, 72%, 8% major. 1 month post-op continence, 80% of dogs with a median score of 10, so 10 out of 10 is perfect. Incontinence recurred at a median time of 24.9 months in 5 dogs, but they responded to medical therapy. Overall, dogs remained continent for 66 months, that's the median, and 88% continent with adjunctive medical or surgical treatment in incontinent ones. Fewer minor complications and post-op recurrences of incontinence were documented after laser ablation versus the neo-ureterostomy. So conclusion, good prognosis overall with few complications. Introduction. Ectopic ureter is rare in dogs, but it's the most common cause of juvenile urinary incontinence. It is a congenital anomaly of urinary system where one or both ureteral orifices are inappropriately positioned caudal to the bladder trigone. Embryologically, improper differentiation and migration of the mesonephric and metanephric duct systems results in 2 possible terminal paths. 95% of cases, the ureter terminates within the urinary bladder wall and is defined as intramural ectopic ureter, whereas extramural ectopic ureter are separated from the bladder. Concurrent congenital abnormalities have been described in more than 80% of cases: renal dysgenesis or agenesis, hydroureter, ureter seal, pelvic bladder, congenital urethral sphincter mechanism incompetence, vestibulo-vaginal septal remnants, and recessed vulva. Traditional open approaches for correction include neo-ureterostomy with either ligation of the distal ureter tunnel or reconstruction of the urethral trigonal region, and neo-cystoureterostomy or ureteral reimplantation. Extramural ectopic ureter is treated using neo-cystoureterostomy, whereas intramural is typically treated with either neo-ureterostomy or less commonly neo-cystoureterostomy. These procedures, which require an open laparotomy, are associated with post-op morbidity. Surgical revision needed in 21% of cases. Recently, laser has been described for intramural. A few complications, and the outcome after ectopic ureter correction, post-operative continence rate ranged from 36 to 72%. Materials and methods. Complications were classified as major, meaning requiring surgical revision, like uroabdomen, ureter obstruction, or stenosis, or minor complications, meaning no surgical revision required, such as lower urinary tract symptoms. Procedures. Neo-ureterostomy was performed by urethral trigonal reconstruction, so ligation and transection of the prepubic urethral portion of the ectopic ureter. In the eventuality of ectopic ureter seal, ureterocolectomy was performed in addition to neo-ureterostomy. Cystoscopic-guided laser ablation was performed without fluoroscopy under endoscopic guidance using a telescope 30 degrees, 9.5 French, 14 centimeter, with a holmium, yttrium, aluminum, garnet laser, and a 230 micrometer laser fiber, 10 hertz, 1.2 joules. Continence status was described by the owners from a 1 to 10 point scale. 1 was completely incontinent, 10 fully continent, so they wanted 9 or 10. Results. Median age, 5.9 months. Median weight, 13.3 kilograms. Mostly retrievers, followed by terriers, 72%, medium to large dogs, 12% spayed. The median continence score was 1. Prior to surgery, urine cultures were positive in 70%. Ultrasound was performed in 100% of cases, cystoscopy 84%, CT 16%, and other tests. Conformational abnormalities were diagnosed in 76%, with 64% having more than one. 76% had urinary-related abnormalities, 52% genital malformations. The maximum urethral closure pressure was 23 centimeters of water. This was considered normal based on previous studies of healthy, intact female dogs, 17 to 29 centimeters of water. Therefore, they did not diagnose urethral sphincter mechanism incompetence. Preoperative findings: median age 7.9 months, median weight 19 kg. So these are usually puppies. That's why the numbers now are they're older and they weigh more. Among the 25 dogs, 40 external ectopic ureters were diagnosed. 15 dogs, or 60%, had bilateral. 40% had unilateral. Intramural, 96%. The site of the terminal ureteral opening was recorded in 25% dogs had proximal, 38% distal, 38% both. Procedures: neo-ureterostomy, laser ablation, and neo-cysto-ureterostomy were performed in 52%, 32%, and 8% of cases respectively. Some had combined procedures. 42% had persistent ureteral remnant in the pubic urethra distal to the ligation site after surgery. All of these dogs after neo-ureterostomy. Additional procedures were performed in 8% of dogs, included spaying and pubic symphysiodesis. Post-op findings: all dogs survived. Median hospital 3 days. Complications: minor 72%, lower urinary tract symptoms which lasted a median of 5 days. Minor complications rate and duration of 100% lasting 9 days after neo-ureterostomy and 30% lasting 0 days after laser ablation. Lower urinary tract symptoms were more frequent with the surgery versus laser, and duration was longer with surgery than laser. Urinary-related major complications following correction occurred in 4% of cases, with the dog with a uroabdomen after neo-cysto-ureterostomy, intestinal intussusception. Major complications were 8%. All required surgery. Revision. Outcome: short-term outcome after 1 month follow-up, 80% continent without any medication. Median continence score 10. 20% had incontinence after surgery, which improved compared to the preoperative scores. When comparing surgery versus laser, no significant difference regarding incontinence persistence was observed. The pressure to diagnose the where's the abbreviation here? Maximum urethral closure pressure, to diagnose incontinence, were suggestive of that in only 2 dogs, based on normals, which is 17 to 29 centimeters of water. So treatments included phenylpropanolamine, or PPA, and urethral hydraulic occluder. Long-term outcome: median duration of follow-up 38.9 months. Incontinence recurred in 25% of dogs at a median of 24.9 months after surgery, all after surgery. At follow-up, the estimated proportions of continent dogs: 95%, 88%, 71% at 1 year, 2 year, and 3 years from 1 month following surgery. The median duration of continence: 66 months. When comparing laser and surgery to treat intramural, the proportion of recurrence after laser was 0, which is significantly less than after surgery, which is 5 out of 12. And then they could also use, besides the medications mentioned, phenylpropanolamine, they can use estriol as well to treat some dogs with issues with incontinence. At the last follow-up, continence was achieved in 60% of dogs with surgery alone, or rather with ectopic ureter correction alone, 24% with correction and medication, 4% with correction and placement of urethral occluder. In total, 88% continence achieved by surgery alone or surgery with medication. Postoperative urine culture: 30% had a UTI after 1 month, and during the entire follow-up, 7 were diagnosed. Discussion: 88% of dogs achieved continence after correction of ectopic ureter and maybe needing additional medication or surgical treatment, with an associated urinary-related major complication rate of 4%. Continence lasted 66 months during follow-up, and all dogs with recurrence of incontinence respond to medications alone. Laser ablation was associated with fewer minor complications and a low proportion of incontinence after correction compared to surgery. So medium to large breed dogs were overrepresented at 72%. The persistence of incontinence may be due to decreased bladder capacity, disturbance of the urethral sphincter secondary to the surgical approach, or to the persistence of distal ectopic ureter remnant or associated urethral sphincter mechanism incompetence. The median duration of follow-up was 38.9 months. Dogs were continent after surgery remained so for a median of 66 months, with recurrence of incontinence in 5 out of 20. Recurrence of incontinence has been reported after ectopic ureter correction, which could be from urethral sphincter mechanism incompetence, especially after they were being spayed, but no association between incontinence recurrence following ectopic ureter correction and spaying was identified in other studies. Spaying and urethral sphincter mechanism incompetence are some hypotheses, but also urinary tract infections, long-term scarring of the urethral sphincter following surgery, or persistence of a ureteral remnant that could disturb the urethral sphincter mechanism. So dogs that are continent after surgery have a good long-term prognosis, even if you need medication. Dogs that fail to respond to correction are less prone to respond to medications and have a worse long-term continence prognosis, described in other studies. Factors to explain this finding may include more complex congenital or functional abnormalities in dogs with incontinence persistence compared with those who experienced incontinence recurrence. Minor complications in 72%, which are lower urinary tract signs for a median of 5 days. Minor complications happen in all dogs that underwent surgery, so higher risk there. Previous studies with cystotomy alone found 37 to 50% minor complications. They reflect the invasive nature of surgery and urinary trauma. Post-op culture was positive in 32%. The presence of asymptomatic bacteriuria has been reported up to 10% of dogs. Dogs undergoing ectopic ureter correction may be predisposed to post-operative urinary tract infection. Several studies have previously reported the use of laser for intramural correction in females and males. Proposed advantages include minimally invasive. You can also diagnose and treat at the same time. You can resect the entire length of some distally opening intramural ectopic ureters. 90% of dogs treated by laser were continent after short-term evaluation in this study, although no difference in incontinence was found compared with surgery. Nevertheless, incontinence did not recur in any dog with laser, a complication documented in 42% of dogs treated with surgery. In addition, laser was associated with a lower risk of incontinence recurrence and fewer minor complications than neo-ureterostomy for intramural correction. Laser ablation also allows removal of the intramural ureteral path. The risk of urethral tears during the procedure and subsequent uroabdomen exist. These findings prompt us to recommend the laser to treat intramural in female dogs. Fluoroscopy can be used to determine the anatomic position of the ureter and confirm the correct position of the newly formed ureterovesical junction within the bladder, potentially reducing the risk of urethral tear during laser ablation. In conclusion, most dogs in this study regained continence by 1 month after surgery, although incontinence recurred in some dogs about 2 years after surgery. Dogs for which correction alone was successful remained continent for 66 months, and the long-term continence was achieved in 22 out of 25 of dogs with surgery or medications together. Laser ablation had few minor complications and incontinence recurrences compared to surgery, so they recommend laser for female dogs with intramural ectopic ureters. Yeah, I mean, nothing too crazy there. This is pretty much standard for this condition in these dogs. And so if you have a puppy that's got urinary incontinence, for pet owners out there who are listening to this, this is a differential. It is easily missed because it's all internal. But then for veterinarians, recommend them to go and see a specialist, because instead of putting them on surgery all the time or medications all the time, you could consider actual treatment with the intent to cure them, or at least have good long-term follow-up with less need for medications. All right, guys, we'll see you in the next video. Take care. Bye.